Well, good afternoon. When the coronavirus pandemic hit, Congress passed the CARES Act, which did include some aid to state and local governments. That act was done on a per capita basis. So you take Florida's share of the population and you divvy up the money and basically make it fair based on population. The bill that the House had passed and then the Senate has now passed a revised version of the bill contains the same basic flaw. They are penalizing states like Florida who have performed better economically during the pandemic, and they are rewarding the lockdown states who've made a lot of terrible decisions, hurt a lot of people. They are rewarding them for having higher unemployed populations. And so the way this current bill is structured, Florida will end up with approximately $2 billion less in aid under the unemployment methodology than we would be provided if Congress used the same per capita distribution of funds that was used in the CARES Act. California ends up with more than $6 billion extra in aid than if it was done on a per capita basis. New York gets more than $2 billion extra in the stimulus than if it was done on a per capita basis. Illinois and New Jersey each get more than $1 billion in additional funds. And all those states have something in common. They're all deep blue states under Democrat control, and they're lockdown states. And they've caused a lot of damage with their policies, and now they're getting bailed out under this bill. So to take money from Florida and to send it, and from Georgia and a few other states, and to send it to California, Illinois, New York, New Jersey, I think is just fundamentally unfair. And let's just look at the results that we've seen so far with the coronavirus pandemic. You can't say that they had to lock down because that was necessary to stop the spread. It did not stop the spread. It failed. If you look at the mortality per capita for 65 and older, which is really the fairest way to do it because we have a much older state, Florida has lower per capita mortality for 65 and older than California, Illinois, New York, and New Jersey, way less than New York and New Jersey and Illinois. And so that is the fact, and yet we've done it in a way, instead of always locking people down, trying to lift people up, saving people's livelihoods, saving their jobs, saving their businesses, so that right now, even with that mortality among 65 on a per capita basis lower than those lockdown states, unemployment in Florida is 5.1% for the most recent month in December, California 9.3%, Illinois 8%, New York 8.7%, and New Jersey 7.7%. So this bill punishes Florida. It punishes Georgia and other states that had a more rational, successful approach to dealing with the pandemic, who understands that you can't just lock people down indefinitely and things will all of a sudden work out. So I think that this should be corrected. I think it should be done on a per capita basis. I mean, I'm not asking for anything special for Florida. As you remember, I vetoed $1 billion out of this year's budget. We withheld some of the money from the agencies, told them to hold back a little bit because we didn't know what the future would hold. But because our economy is doing well, because we've put people back to work, we now have more tax revenue than was forecasted a year ago, 6 months ago, or heck, even in December with the December estimate. If you look at what the revenue was in February, far in excess on sales tax, on dock stamp tax, on a bunch of other stuff than even those upward revised estimates. So we think this is unfair. I think it's designed basically to bail out the poorly governed states. Florida is being penalized for having more successful outcomes, and that is not fair. Now, having said that, we continue to plow forward on our Senior First vaccination strategy. We have now done in the state of Florida, well over 2.6 million seniors have had at least one dose reported. We know with the reporting lags, it's probably significantly higher than that. It's over 56% of seniors have had at least one dose. And if you look at on a county by county basis, the ones that are below 50%, some are about 49, but below that, you basically have Hernando and Marion, which we've tried to address recently, doing some pods, and then it's mostly rural counties, which we're also trying to address by doing our rural outreach program. Almost every other county in Florida is at least 50% of seniors that have had at least one shot, and many of them are doing very well. I mean, if you look at some of the top performers, St. Johns County, 78% of seniors have at least one shot. Right here in Leon, 73%. Alachua, 67%. Palm Beach, almost 67%. Massive senior population there. Gadsden, right next door, 65%. Okaloosa, further west, 65%. In Broward, big county, 62%. So we're going to continue to work with our senior population to be able to get as many seniors who want a shot to have a shot. I note that we've expanded our pharmacy footprint in an incredible way. We have 12 Walgreens, 81 CVS's, 730 Publix, 119 Walmart and Sam's Club, and 43 Winn-Dixies offering vaccinations to seniors across 52 counties. We anticipate, and hopefully I will have an announcement very soon, an expansion of both CVS and an expansion of Walgreens. And I think if you look at when we put CVS down in Miami-Dade a couple weeks ago, those Dade numbers really went up. Navarro Pharmacy, CVS, EMOS, you started to see 100, 150, even 200 shots at individual locations down there. And so I think pharmacies like CVS and Walgreens, they understand people come in all the time. This is their bread and butter. So we're going to continue to leverage that to get in as many places as we can. We're going to continue to do the pods, the permanent pods, 87 that we have. We're going to continue to do the faith-based outreach. We're also going to continue with our pods like in Pahokee for underserved communities. As I mentioned, we did launch the rural outreach program, which we're very excited about. We think we can get those percentages up pretty quickly if it's applied in an effective way that's getting people to want to do it. We've done over 25 senior communities. I was just at the On Top of the World in Ocala, very successful vaccination drive there. We're going to be doing more over the next couple days. I've done over 1,500 seniors through our pilot for homebound seniors, World War II veterans, and the like. So a lot of different nodes, a lot of different ways to deliver this vaccine. But I think what we're seeing across the board is if you go back to, say, the end of December, I mean, man, if there was any opening, it would melt every phone line. Online appointments were taken. Thousands of them would be gone in a matter of minutes. What we have seen now is you are starting to see the demand soften a little bit. I mean, I don't know how many seniors are ultimately going to want it. It's not going to be 100%. Maybe it's 70, 75, 80. We'll figure that out. But I definitely see, and the folks who are working with us have seen, a softening. And so if you have the pharmacies have their windows to sign up, they're not gone in 10 minutes like they were a month and a half ago. Sometimes the window will be open for an hour 15, hour and a half. And so we think that that's a good sign because we think that we've reached critical mass on the senior population, have more to do, and we're going to continue to do it. And we're looking forward to having a really strong week this week of vaccinations. If you look last week's reporting is going to take probably 3 or 4 more days to fully populate, but we were doing over 90,000 jabs for first doses, as well as a lot of second doses for most of the days in that week. And so I think that's a great pace. We want to continue doing that, and that'll make a big impact going forward. At the same time, we want to make sure that all these appointments are filled up. We want to make sure that everyone has an opportunity to get a vaccine who may be at increased risk. And while 83% of the COVID-related mortality is concentrated amongst those who are 65 and up, it is the case that people who are between 60 and 64 are at an elevated risk vis-a-vis those who are much younger. And so I'm happy to announce today that starting 1 week from today, next Monday, we will be lowering the age in the state of Florida to 60 plus for vaccinations. And that will apply across the board at all of the state pods, all of the pharmacies, all of the different drive-through sites that are being operated. So again, 1 week from today, if you're 60 plus, you will be able to sign up and be able to get the vaccine. We hopefully by next week will get another shipment of the Johnson & Johnson in. I anticipate what we just got will be gone probably within the next few days. It seems to be pretty popular. We want to gauge exactly how that's going to go. But I do think that this is the right time to do it. We're starting to see the demand soften. We anticipate hundreds of thousands of more seniors this week will get it. And of course, starting Monday, seniors are still obviously going to be able to do it. We're going to continue doing senior pods. We're going to continue to be doing the rural program. We're going to continue to be doing the churches and all the other things that we're doing. But That's 60 to 64. I know a lot of people have been waiting. We'll open it up. And so that each little 5-year wicket in the age distribution, you're looking at, what is that, about almost 2 million people, 1.5 million, 2 million people, each one you do. I would imagine the demand will be slightly lower for 60 to 64 than it was for above 65, but we do anticipate the demand to still be pretty robust when you're talking about this. So I'm excited about that. We're going to continue pressing forward with that. Like I said, we anticipate hitting that 3 million senior mark sometime this week. Whether it'll be reported this week or not, we think the actual 3 millionth jab of a senior will happen this week. And we're one of the top states. You look at, I think we have by far the highest percentage of all our vaccines have been given to seniors. We're one of the tops for the total number of shots given to seniors, as well as the percentage of seniors 65 and up that have had a shot. So we want to continue with that momentum, but also recognize as the demand has softened a little bit, as fortunately more than 50% of seniors in almost all of our major counties have received at least one shot, that we'll open it up to 60 to 64 as well. And then finally, last announcement will be, as many of you know, we're going to be losing our fearless leader around my office, Shane Strum, who worked probably 4 years packed into 2 years with the amount of time that he worked. And he worked, COVID obviously took it to another level, but he was working 80 plus hours a week prior to COVID. And I think I may have been in my office maybe 2 or 3 times where he wasn't also in the show up on a Sunday. He'd somehow be here. I'd show up whenever, odd hours, and he would still be here. So he worked incredibly hard. We're going to miss him, but we are happy to have someone I think will do a great job as his replacement, who's here, Adrian Lucas. And for all the hard work Shane did, usually Adrian was right there with him. Adrian was the deputy chief in charge of all the stuff related to the health emergency, all the stuff when we were doing the testing, the nursing homes, when we were doing the therapeutics, when we're now doing the vaccinations. All of it was under Adrian. So he's worked incredibly hard, very knowledgeable, very smart, and I think he will do a great job. So Shane's going to finish out this week as the chief of staff. I did ask him to just stay one more week to help me out with some other housekeeping items so we can make sure we're going in a good direction. But I look forward to Adrian assuming the role, and I know that he's going to do a great job for the people of Florida. And with that, we'll take a couple of questions.
DeSantis, the COVID relief bill was passed basically entirely by Democrats, as you noted. Republicans in Florida are going to be in charge of distributing the money, however. How would you like to see them distribute the money, perhaps in a way to advance conservative priorities, that in a way, or perhaps in a way that different than what was intended by Congress?
Well, look, we're going to get less money than on a per capita basis. I mean, that's just a fact. And the reason is because we have better indicators in Florida than these other states. So that's not fair. Again, we're not asking for anything. We just want to be treated fairly. I think the Senate has changed some of the criteria. We're still looking through that. The original House bill had more expansive language. I think there's going to be certain things that we were maybe anticipating doing that we may not be able to do. So we'll see how that all gets ironed out. We're going to probably have to wait for some written guidance to come out before we're able to do it. I've spoken with both members, Chris Sprowls and Wilton Simpson, just generally in passing about how would we even handle this. I'm not sure by the time we get 4 or 6 weeks down the road, I don't know that you'll have all the guidance that you need to be able to do it. So we're looking through that right now, but I think it's too soon to tell exactly how you're going to be able to do it. One of the things that may make it more difficult for us is because we have seen the economy bounce back here. You look at dock stamps. I think they were 70% above the February estimate for the month of February. If you look at sales tax, it was 10% higher. The revenue loss is probably not going to be what we would need to justify a huge amount of that going into some of the things that maybe we had anticipated. Maybe it will be. We'll see. We're going to have to look through that. But there's going to be more constraints as a result of what the Senate did. The Senate didn't correct the fact that Florida's getting a lot less than I think what we would be entitled to on a per capita basis, but it is what it is. So we'll work through it. I know we clearly would like to do some of the infrastructure that we were not necessarily not able to do, but with some of the shortfall, some of those projects had to get, at least on paper, delayed. We think we can plug that hole. It does provide in the Senate language the ability to do things for water infrastructure. So as you recall, I've proposed a new program, Resilient Florida, which is $1 billion over the next 4 years to do things to fight some of the effects of sea level rise, to fight some of the effects when we have these storms and the flooding that occurs, particularly in our more vulnerable parts of the state. So I feel confident that as is, we will be able to put a lot of that money towards our Resilient Florida program. And I think that'll be a game changer for the state of Florida. I think it's a really good use of money in terms of infrastructure. It's infrastructure we would needed to have done anyways. And I was even willing to do some bonding to do that because of how cheap the money is. But given the constraints of this program, that may be one way. And I know Senator Simpson and Chris Sprouse are both interested in that. So that may be one thing I think you'll be able to see. I do think conservatives will support it, but quite frankly, that's something that should be pretty bipartisan throughout the state.
Governor,
Yes, sir.
You're actually making your own argument that Florida does not need the money as much because you say you're doing so much better than California and other states. Aren't you making that argument that you don't need it, that harder hit states should get more money?
But they're harder hit because of their policies. I mean, just think about like a California. They've had the theme parks closed the whole time. We've had ours open. People have looked at it. No one has been able to say that this has caused a major difference in the vector in terms of the disease curve. So it was.
They're not doing as well because they're not in the states. Why should they be penalized?
They're not penalized. No. I'm not saying if you give money to states, you give it to everyone equally. I'm not saying they should be penalized, but just give it to us all equally. When you're taking from Florida, taking from Georgia, some of these other states, giving it to those states, that's something that I think is frustrating, particularly because that's not how they've ever really done it. That wasn't how they did the CARES Act. That's not how they did other types of relief efforts. And my view is just, look, these are Floridians. We obviously, again, if you don't want to do it, don't do it. You're not going to hear a peep out of me. But if you do it, then just do it fairly. Don't shortchange them if they have a certain share of the population. But man, when you look at some of them getting plussed up by billions of dollars and us plussed down by about $2 billion, we thought it was going to be about $1.3 billion. But then when they did the revisions of the unemployment downward to 5.1, that took us down even further. So it's, I think it's unfortunate. But look, just so everybody understands in Florida that we are getting less than our share of the population as a result of a deliberate choice not to do per capita, but to do it on the basis of who has more unemployed citizens. And I meet people almost every time I go out from some of those states who have moved to Florida because they weren't able to work in some of these states. I was at the Strawberry Festival yesterday. I met people from every one of those states who have moved to Florida within the last 6 months. This is just at one event in Florida, and I'm seeing that representation on the ground. Policy matters. So I do think, I know we're going to get the numbers. I think they did do a little bit better in the last few days. I don't think there have been big lines for any day, but I do think they did better than that pace that they did on Wednesday. I think they did a little bit better Thursday, Friday, but I think they have a different way to do it. So there's different ways to do it. Remember, when one of the hospitals or one of the counties said, hey, seniors, just show up, and there was long lines, people got upset at that. They criticized it. When you do online, man, it's a race to get online and get those appointments. When you do phone calls, it melts the lines. You got to make sure you have a lot going on. So there's different. When we do our church outreach, we will work with the churches and say, get your parishioners, we'll show up with the vaccine, you roster them, and we'll do it. Same with the 55 and up communities. What they're doing, I think, is kind of a hybrid of that. They're not doing reservations per se. They're going in areas that have a higher social vulnerability index, knocking on a lot of doors, trying to do word of mouth to be able to have people come to the site. So it's a little bit more labor intensive, and maybe as word spreads, you'll start to get more. I do think, though, it's a valuable way to do it, because what we found is if you do the online stuff, there's some people that are fine with that. Some people's sons and daughters can do it for them. There's others that may not have as easy access. So when we're going to a church, you're getting people kind of through word of mouth through them. When we go to some community, we were in Hernando at a mobile home park the other day. I was with Blaze Angoli and Wilton Simpson. And there were some seniors who were very elderly who they were not going to leave the community. And so that really helped. So I think it's good to be able to do that, because I think if you show up and knock, you'll probably get some folks who have fallen through the cracks. But in terms of it being like massively oversubscribed, we just haven't seen that yet.
You talked about trying to reform the emergency powers of local governments. Is that because you're concerned that governments are going to keep the mask policies going forward for the coming year?
Well, as you know, I mean, we protected Floridians from being penalized by that. I think it's to be fining people for these things at this point. I believe that a long time ago. It's not right. But I'm really concerned about, and I know I have orders in place about closing businesses. The fact is, that's an awesome power to be able to just essentially concede to a local government that someone can't even earn. And if you look at South Florida, they would have kept a lot more of this closed if I had not come in and said everyone has a right to work, every business has a right to operate. I mean, you look at some of those places are booming right now because I effectively came over the top rope and said, enough of this, we've got to put people back to work. But I just worry going forward, when would some of this end? You look around the country, you've had places that have effectively been shut down for a year. You look at some of the places in California, they've been shut down for a year. So how is somebody going to be able to make an income, earn a living on some of that? And I think there does need to be reform. I was also, when I first started thinking about this, in favor of reforming the governor's powers. However, the legislature currently has the ability with a majority vote to come in and terminate the emergency powers. So that's under current state law. I think that that's really good. Now, obviously, I think I've handled this in a way that a majority of the legislature approves of. So they haven't done that. But it is a serious issue if you have an emergency that is not for a finite period of time and that can kind of just drag on. And then with some of these governments throughout the country, and not necessarily in Florida, but some of the local governments, they would put these totally unrealistic guidelines down of like you have to meet certain number of cases per 100,000, which are really not even attainable. So I think that there needs to be protection for folks, and you shouldn't have your entire livelihood just upended because of one emergency dictate by somebody in a mayor or a local government. So I think that if the CARES Act had happened during the legislative session, I would have said that the legislature should be involved in that. The fact that if this does come down during the legislative session, for me to be spending that unilaterally while the legislator's in session, I don't think would be an appropriate way to govern. And so, of course, I think that they should be involved in that and appropriating as much as can. Now, if this isn't done, if we don't get it, we don't necessarily know, because there's going to be a lot of stuff that's going to have to be worked out on this. You may need to come back for a special session. There may be some things that I would be able to do unilaterally, but my hope is that we would have some type of framework that would not just be unilaterally from the executive, that would also be from the legislature and have the legislative sanction. I think the emergency powers are really meant to be able to move money around when you don't have the legislature in session, when it just wouldn't make sense to have to go back and do all that when time is of the essence. I mean, we've moved money around for different things to respond. But in this case, yeah, I think that we should be able to get together, have them appropriate most of it, and hopefully do that in a responsible way. One more.
30 minutes, Deloitte is expected to get a grilling from senators in the pandemic committee. You said a while back that the Connect system, which they created, was a jalopy. After the IG's report that was released here last week, do you still feel that way?
Well, I'm still reviewing it. But I will say this, I think, because you've seen these other states, everyone had problems with it. I mean, this is really a black swan event. It was not like a typical recession. You stop the economy. I mean, in fact, we were talking about it the other day, the theme parks, they stopped. Everything kind of just stopped. the week, so this coming week of TPC golf, I went to TPC, everyone was excited. Then they just stopped it. And then other things stopped that weekend. And that threw hundreds of thousands of people out of work. So it was a real difficult situation. But I do think that the issue is there were some issues with the way it was, the architecture, but the amount of pinging that you have to do. Because some of these states that didn't do that, as we know, tens of billions of dollars in fraud in places like California. Our view was, we got to verify it's a real person. You know, I can't have the people of Florida paying billions of dollars to Nigerian princes. It just ain't going to happen. So consequently, you're having to ping against Social Security, some of these other things. When you have that much volume, it makes it very, very difficult. So I look forward to seeing what they say with Deloitte. And obviously, we're going to probably have to do something on the fiscal side to be able to make sure that the system's better going forward. Okay, thanks, everybody.